Hello everyone, I'm Dr. Spoorti Kapate, pediatrician and neonatologist at Cloudnine Hospital, Electronic City. So the next question is nursemaid's elbow. It is also commonly called as pulled elbow. It is basically dislocation of a bone from the elbow joint. Your radius bone is dislocated or it comes out of the socket of the elbow joint. It is most commonly seen in children less than 5 years of age. Beyond 5 years, it's not very common. And once it happens, it might happen again within the next 3 to 4 weeks because it is still not completely healed. So why it happens? Because the joints and the muscles and the tendons, they're all very lax. So when a child is, say, walking and a parent pulls the hand of the child at the holding the hand or the wrist and just pulls towards them, this elbow joint can get dislocated. The most common causes is one, the parent is pulling the child, trying to lift the child only with one hand, or swinging the child with one hand, or while walking the child is trying to run away and the parent is pulling the baby with that one hand. So whenever a lot of force is applied, because of the traction, the radius bone can get dislocated from the elbow joint, resulting in your pulled elbow or nursemaid's elbow. Symptoms would be, obviously the baby is going to be in pain, so is going to cry. You can differentiate this from an fracture, where most of the times fracture will cause a huge swelling and the crackling noise and all of that. So that won't be there in a pulled elbow, and the baby will not be able to move the joint at the elbow, but the movement in the shoulder joint will be present, so that way you can differentiate, and the baby will try to hold the hand very close to their body and not have any kind of movements. So these are the symptoms of nursemaid's elbow. Treatment is reduction, which is done by a doctor. Please do not try it at home by yourself. The doctor or the pediatrician or an orthopedician, they will try to put the dislocated bone back into the joint. That procedure is called reduction. We give you painkillers so that the baby is relieved of pain, and then we monitor the baby. Of course, if the baby doesn't move the hand beyond 48 hours of reduction, then you can get an X-ray done to see if there is any other associated fractures.